It's a global pandemic. So what can we learn from other countries? The latest COVID-19 projection for Canada's largest province population-wise includes an alarming comparison between Ontario and 4 other countries dealing with massive outbreaks: France, Germany, the UK, and the Netherlands. Think of it as a way to possibly look at what the future could hold. These countries hit their second wave earlier than our part of the world. Now, an optimistic forecast is that the province could be on the same, or in some cases worse, trajectory.
At a 5% rate of growth, which might be considered either somewhere between current and an optimistic scenario, our case numbers will likely exceed several jurisdictions in Europe that are now in lockdown. We're starting to mount the same curve that they did earlier on this fall.
The dean of the Dalai Lama School of Public Health at the University of Toronto said Thursday Ontario is expected to hit about 6,500 new daily cases by mid-December, about 4 times the current level. And with an eye on what's happening in parts of Europe.
In this case, we're looking at France, Netherlands, the United Kingdom, and Germany.
Here's what's happening now in those regions. France is under its second national lockdown. People here only allowed to go out for work, to buy essentials, or for an hour of exercise within a kilometer of where they live. Most stores are closed. Schools are still open, though. Hospitalizations here just hit a record high. The Netherlands, with one of the highest per capita infection rates worldwide, now in a partial lockdown. Indoor dining is banned, masks are mandatory, alcohol sales not allowed after 8 p.m. People are asked to stay at home, and more measures not ruled out. To the UK, where the death toll topped 50,000 this week, a second lockdown is in effect in England. Bars, restaurants, gyms, and non-essential shops all closed for 4 weeks. Here, too, those schools remain open. Households not allowed to mix. And in Germany, which hit a new high of more than 23,000 new daily cases Friday, a partial lockdown has closed restaurants, bars, sports facilities, but has kept schools open. Tougher rules could be coming next week. The challenge these regions have all seen, according to Dr. Brown, is trying to get control after strong case growth.
The later that one intervenes in the epidemic curve, the harder it is to get the case growth under control.
Well, it now looks like more measures are on the way. What would happen in Ontario if no new restrictions are added?
Based on what we're seeing in the models, if we continue on with the current level of restrictions, I would not expect to see any deviation from the current results. You'd continue to see growth.
Melissa Duggan, City News.